Welcome back, everyone. Ready to dive deep again.
Always. What are we exploring this time?
Today, we're tackling bipolar disorder, specifically bipolar 1 and bipolar 2.
Ooh, that's a big one. Lots of misconceptions floating around out there.
Exactly, and we're going to set the record straight using a really thorough teaching guide on this subject.
Love a good guide. So, what kind of fascinating insights can our listeners expect?
Well, we're going to unpack what bipolar disorder actually is beyond, the common myths.
Right, not just your everyday ups and downs.
Not at all. We'll break down the differences between bipolar 1 and 2, those mood episodes, what sets them apart.
The nitty-gritty.
Exactly. And we'll delve into the science of it all. Genes, brain function, those key neurotransmitters, dopamine, serotonin, the whole shebang.
The biological factors at play, always fascinating.
And of course, how it's diagnosed, what tools professionals use, and the most effective treatment approaches.
Medication, therapy, lifestyle change, the whole package deal.
All of that. Plus, as always, a final thought to leave everyone pondering.
Love a good brain teaser. All right, let's jump in.
Let's do it. So, first things first, bipolar disorder is more than just mood swings, right? We need to establish that from the get-go.
Absolutely. It's about intense shifts. Shifts in mood, energy levels, activity levels, and these shifts, they're significant. They really impact your day-to-day life. It's not just, feeling a little down one day and then up the next.
So it's really about the intensity, the impact on your life. Would you say that's a good way to put it?
Definitely. It's about how these shifts disrupt your ability to function, to work, to maintain relationships.
Now let's talk about the different types. Bipolar 1 and bipolar 2, I think that's where a lot of the confusion comes in. So could you walk us through the key distinctions?
Okay, so bipolar 1, you're looking at least one manic episode. And a manic episode, this is a period of really intense, elevated mood.
Elevated mood, okay.
Yeah, and energy. And it can be so severe that it can lead to hospitalization. Think of it as like someone's internal go button gets stuck, just stuck in the on position.
Wow. I can see how that could quickly become unmanageable. What would that look like in practical terms? How would someone experiencing a manic episode behave?
Well, you might see someone who's suddenly euphoric, like they're feeling invincible, on top of the world. They might be talking nonstop, like a mile a minute, and their thoughts are racing. They could be making really impulsive decisions, spending money recklessly, engaging in risky behaviors. They might not be sleeping, or they're sleeping very little, but they're still full of energy.
It sounds like it could almost be mistaken for, extreme productivity or something, at least in the beginning.
That's a good point. It can be deceptive. People might see them as being super productive or creative, but it's not sustainable. And it can quickly spiral out of control, leading to serious consequences.
Okay, so that's bipolar 1 with those intense manic episodes. How does bipolar 2 differ?
So bipolar 2 also involves periods of elevated mood, but they're less intense, what we call hypomania.
Hypomania.
Right. It's still disruptive, but it's not typically severe enough to require hospitalization. But here's the key difference. Bipolar 2 always involves at least one major depressive episode.
So both types involve these highs, but the intensity and the presence of a depressive episode are the main distinctions.
Exactly. It's like two sides of the same coin, but the balance is different for each type.
Now, I'm always curious about the why behind things. What's happening in the brain to cause these dramatic shifts between these extreme highs and lows?
It's complex. Like most things in the brain, it's not a simple answer. It's a combination of our genes, our genetic predisposition, and environmental factors.
Nature and nurture.
Exactly. Research has identified certain genes that can increase the likelihood of developing bipolar disorder, but that doesn't mean it's inevitable. Environmental triggers like extreme stress, trauma, even substance abuse, these can all play a role in triggering the onset of the disorder.
So it's like having this genetic vulnerability, and then certain life events can kind of flip the switch, so to speak.
That's a good way to think about it. And then there's the role of brain chemistry, specifically neurotransmitters like dopamine and serotonin. They're the messengers in our brain. And in bipolar disorder, their messages get a little scrambled.
Okay, so talk to me about dopamine. What's its role in all of this?
Well, dopamine, it's involved in reward, motivation, pleasure. Increased dopamine activity is linked to mania. Like, imagine your brain's accelerator stuck to the floor. You feel incredibly energized, driven, but it's almost impossible to control. It can lead to impulsive behavior, risky decisions, the kind of things we talked about earlier.
So it's not just about feeling happy in a manic episode. It's more complex than that. It's like this intense drive, a feeling of being unstoppable almost.
Yes, exactly. And then you have serotonin, which is involved in mood regulation, sleep, appetite. When serotonin levels are low, it can contribute to both the manic and depressive phases.
So both the highs and the lows are influenced by low serotonin.
Exactly. It's like the brain is struggling to find that sweet spot, that balance for mood stability.
So given this complex interplay of factors, how do mental health professionals actually diagnose bipolar disorder? How do they know what they're dealing with?
It starts with careful observation and assessment. Psychiatrists use specific criteria outlined in the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders. This helps standardize the diagnosis. They'll look at the pattern of mood episodes, their severity, how long they last, how frequent they are to differentiate between the types of bipolar disorder and rule out other conditions.
I imagine it's like putting together a puzzle, trying to get a clear picture of what's going on.
Yes, exactly. It's a process. And they may use specific tools like the mood disorder questionnaire, which helps them gather more detailed information about the individual's experiences.
So it's not just a quick chat, it's a thorough evaluation.
Absolutely. It's important to get it right to make sure people are getting the right treatment.
Speaking of treatment, what are the go-to approaches once someone is diagnosed with bipolar disorder?
The good news is there are effective treatments out there, and it usually involves a combination of medication, therapy, and lifestyle changes. It's really about finding what works best for each individual.
A personalized approach, that makes sense. So let's break it down. What role does medication play?
Medications are often a key part of managing bipolar disorder. Mood stabilizers are commonly prescribed, and they can help prevent the extreme highs and lows. It's about creating more stability.
Keeping those mood swings in check.
Right. Then you have antipsychotics, which can be really helpful during acute manic episodes. They can help bring those symptoms under control more quickly. And in some cases, antidepressants might be prescribed for the depressive phases, but those have to be managed very carefully because they can sometimes trigger mania in people with bipolar disorder.
So it sounds like finding the right medication and dosage is really important, and it can take some trial and error.
Definitely. It's not a one-size-fits-all situation.
So medication helps manage the biological side of things, but what about the emotional and social challenges that come with bipolar disorder? That's where therapy comes in, right?
Absolutely. Therapy is crucial. It provides people with coping mechanisms, strategies to manage their condition, and navigate those challenges.
What types of therapy are particularly helpful for people with bipolar disorder?
There are a few. Cognitive behavioral therapy, or CBT, is really effective. It helps identify and change negative thought patterns and behaviors that contribute to mood swings.
So it's about changing the way you think about and react to things.
Exactly. Then there's interpersonal and social rhythm therapy, which focuses on stabilizing routines and relationships. Because when your mood is all over the place, it can really impact your relationships and your daily routines.
Makes sense. Consistency and stability are probably super important.
Absolutely. And don't underestimate the power of lifestyle changes. Managing stress, getting enough sleep, sticking to a regular sleep schedule, avoiding drugs and alcohol, these all play a role in mood stability.
So it's a holistic approach, addressing all aspects of a person's well-being.
Exactly. It's about empowering the individual to take control of their mental health. And early recognition of warning signs is huge. If someone knows their triggers, they can reach out for help sooner, potentially preventing a full-blown episode.
So knowledge is power, being in tune with yourself.
Absolutely. And building a strong support network, that's so important too. Family, friends, mental health professionals, they can all provide support and help the person stay on track.
So it takes a village, as they say.
It really does. And one more thing, I think it's really helpful for people with bipolar disorder to work with their healthcare providers to develop a crisis plan.
A crisis plan, what's that?
It's a plan that outlines what to do if they experience a severe mood episode, who to contact, what medications to take, how to stay safe. It's a roadmap for navigating those difficult times.
That sounds like an incredibly valuable tool. Well, this has been incredibly enlightening. I feel like we've really covered a lot of ground.
Me too. It's been great.
We've learned about the different types of bipolar disorder, delved into the brain science, and highlighted those diverse treatment approaches. But before we go, I want to leave our listeners with a final thought to ponder. If both bipolar 1 and 2 involve depressive episodes, how can someone effectively differentiate their experience from, let's say, typical sadness or a temporary low mood?
That's the million-dollar question. And it really highlights the complexity of mental health. You see, it's not just about feeling sad. The intensity, the duration of those low moods, how much they impact your everyday life, That's what distinguishes a bipolar depressive episode from just having a bad day or feeling down for a bit.
So it's about recognizing those signs, that something might be more serious than just a passing mood.
Exactly. And if you're experiencing significant changes in your mood, sleep, energy levels, concentration, your ability to function, don't ignore it. Reach out to a mental health professional. They can help you figure out what's going on.
It's a powerful reminder that professional help is available and it can make a world of difference. Bipolar disorder is manageable. With the right support and treatment, people can lead fulfilling, meaningful lives. Thank you so much for joining us on this deep dive into the world of bipolar disorder. Remember, knowledge is power, and together we can help break the stigma surrounding mental health.
Couldn't have said it better myself. Until next time.
See you then.